Hello everyone, I hope you're all well. So you must be seeing a case scenario on the screen in which it is explained that a 75 years old female comes to you with a complaint of generalized weakness, difficulty performing daily activities, and a noticeable decrease in physical strength or the past year. She has also noticed a decrease in her ability to maintain balance, resulting in an increased risk of falls. Additionally, she has experienced unintentional weight loss and reduced appetite. Her medical history includes HTN, means hypertension, osteoarthritis, and osteopenia. Upon physical examination, you find out the following things: reduced muscle mass and tone, decreased grip strength, limited range of motion, mild cognitive impairment, and the signs of frailty. So what could be a possible diagnosis? You have four options in front of you. Please select one. The first option is ALS, amyotrophic lateral sclerosis. Second one is sarcopenia. Third one is cancer. And the fourth one is depression. You have only 30 seconds to make a diagnosis. After that, I will tell you which answer is correct. So your time starts right now. I hope you have selected your answer and have also mentioned it in the comment section. Now let's move on to discussing this case and see which answer is correct based on what. So first of all, let's talk about the first option, which is ALS. This case is less likely to be ALS because of various reasons. The first reason is age, as ALS can affect individuals at any age but commonly presents in people between ages of 40 and 70. The second factor, which is more important, was related to the symptoms of the disease. ALS usually manifests with rapidly progressive muscle weakness that result in severe disability and eventually death. But in this case, the progression was very slow, almost of 1 year. And also, ALS often shows signs of upper motor neuron dysfunction, such as brisk reflexes and spasticity, which are not present in our case. So this case is less likely to fall in ALS. Let's proceed with the second option, which is sarcopenia. Basically, sarcopenia is primarily an age-related condition and often affect older adult. Our patient is in a typical age group for sarcopenia, and also it progresses slowly over time, which is consistent with our patient complaint. The predominant symptoms in our patient case are muscle weakness, decreased mobility, and muscle atrophy, which align with the clinical presentation of sarcopenia. Also, the physical examination findings such as reduced muscle mass, grip strength, and signs of frailty are consistent with the muscle loss and weakness that are associated with sarcopenia. So, the possible diagnosis of this case is sarcopenia. Now let's discuss the remaining two options so that we can understand the reasons for excluding them. If we talk about cancer, then this is not a case of cancer due to various reasons. The first reason is symptom, and this is a main reason. While both cancer and sarcopenia can result in unintended weight loss, but cancer is typically associated with other symptoms such as pain at the tumor site, change in bowel or bladder habits, unexplained bleeding, and specific symptoms related to the affected organ. While in our case, the main concerns are muscle weakness and reduced mobility, which are more indicative of sarcopenia. Also, physical examination may reveal findings related to tumor, whereas in this case, the physical examination primarily showed atrophy. Lastly, there is also a rapid progression of symptoms in case of cancer. So, all of these make cancer less likely to be the initial diagnosis. Now, if we talk about the depression, then this is not even a case of depression, because in depression, the symptoms are typically associated with emotional and psychological factors such as persistent sadness, loss of interest in activities, changes in sleep and appetite, and feelings of hopelessness. In contrast, in this case, the main complaints revolve around the physical symptoms, particularly muscle weakness and reduced mobility, which are not the characteristics of depression. So on the basis of this, we have excluded the depression also.